Welcome to the one-day surgery section of Surgical Services Lunch and Learn 2015. To begin, on behalf of the staff of the one-day surgery department, I would like to say thank you for all of the hard work you've done this year. We understand that it takes a lot of hard work from your offices and clinics to make sure everything is ready for our patients on the day of surgery, and you've done a great job. Because of this, the staff wanted to present the one-day surgery section differently than we have in previous years. Instead of presenting general information about the department, we would like to discuss a few things we believe, with your help, can provide a more positive patient experience on the day of surgery. First, let's talk about paperwork. The paperwork we receive from your offices or clinics need to have the legal name of the patient. Many times we have cases scheduled and paperwork received with the patient's nickname or familiar name and not the legal name. When this happens, the paperwork from your office has to be relabeled and our paperwork has to be reprinted to reflect the legal name. Also, please note that per hospital policy, we do not change patient names on the day of surgery. So if you are aware that there is a conflict with the patient's legal name, please ask the caregiver to correct this with the hospital before the day of surgery. Abbreviations. Abbreviations are not allowed on the consent form. Signature of the legal guardian. Please ensure that the person signing the consent, if it's signed in your office or clinic, is the legal guardian. If the person with the patient on the day of the visit is not the legal guardian, please make sure that the caregiver is aware that we will ask for and need the legal guardian on the day of surgery. We've had several upset nanas and various others who are the caregivers of the patient but not the legal guardian, and they cannot sign the consent. Witness. When you sign your name as the witness, you are stating that you witnessed the legal guardian sign this consent form. We receive lots of consents that are signed by the guardian but not witnessed. The staff will ask for the legal guardian to re-sign the consent before they sign as the witness. This sometimes causes an issue if the legal guardian is not present on the day of surgery. Informed consent. This has to be signed before the patient goes to the OR and should have all elements completed. This includes the date and the time. Reducing surgical site infections. Children's of Alabama is working to reduce hospital-acquired conditions. One of these is surgical site infections. Caregivers should be told that patients should bathe with antibacterial soap the night prior to surgery, for example, Dial or Safeguard. They should shampoo their hair, dry off with a clean towel, put on clean clothes after their baths, and that includes freshly washed pajamas and underwear. And 1 hour after their bath, they should use the CHG wipes given to them by your staff. They should also be told that the patient should not shave within 24 hours of the surgery or use beauty products, for example, lotion, powder, body spray, perfume, cologne, makeup, and hairspray. For our babies. Instead of antibacterial soap, it's okay for babies to use their regular bath products. Also, do not use CHG wipes on infants less than 2 months of age. Discharge times. When caregivers are with us on the day of surgery, it's a stressful time. Having to worry about the after-school or after-daycare plans for other siblings is added stress. Regardless of the procedure, Make sure caregivers know to plan for the care of other siblings and to expect a full surgical day. Home care instructions. Please keep your home care instructions up to date. If you have a change in practice, personnel, or telephone numbers, please make these changes and send them to Karen Cochran in the Patient Health and Safety Department. She is also the person you will need to speak with to make sure the instructions are on the correct literacy level, as well as the possibility of having them translated into other languages. One-day surgery discharges patients according to anesthesia's discharge criteria. Therefore, if you would like to see the patient before we discharge them, as per our unit policy, please let us know by writing an order. This is the best way to make sure there are no miscommunications. By working with our common goal in mind, together we can achieve excellence in patient-centered care. Once again, on behalf of the One-Day Surgery Department of Louder and Benjamin Russell, we'd like to say thank you.